So here is a simple explanation of what happens when an implant is placed. So this is the implant. These are the various layers, starting with the epidermis, dermis, muscle, formation of a capsule, and then beneath the implant, this is the bone. So starting with epidermis. So the epidermis thickens. Up to 4 to 6 weeks, the epidermis thickens and then gradually it reduces. Maybe the initial thickening is due to edema, followed by dermis. Dermis actually thins out. So soon after the implant is placed, the dermis gets stretched and it starts getting thinned out. Actually, this thinning out can stay for 7 to 8 months even after removal of the implant. What else happens? There are various adnexa. Then there are hair follicles. So when the expander is placed, these hair follicles go wide apart. In case the patient has dark hair, then you can see that the hair appears to be sparse. The hair follicle is compressed, but basically histologically there will be no problem. Once the implant is removed, you shall see that everything comes back to normal. No permanent damage happens to the adnexa. The thin dermis actually in this, there is increase in vascularity. How it happens? One, the vessels get stretched, the elastin in them increases, the collagen in them decreases. Then there is also angiogenesis. Not just the skin that is over the implant, actually even skin adjacent to the implant, which also gets recruited because of the implant, even there the vascularity is increased. When you actually compare it with a delayed skin or delayed skin related flap, you will see that this one, which has been expanded by an implant, has better vascularity. Next, coming to the muscle. The muscle actually gets stretched. Microscopically, there is damage. The myofibrils inside the muscle, they get rearranged in different directions. Not just that, also there is interstitial fibrosis. But all this, it leads to more repair. And if you see finally, the sarcomere per unit length of muscle fiber will have increased. Once the implant is removed, then the muscle comes back to normalcy. Next is the capsule. A wonderful capsule forms because of the collagen. These collagen later on recruit more and more collagen and they form collagen bundles. This may take up to 4 weeks or 6 weeks. Then there is a increase in there is new vascularity in this capsule, because of which this capsule alone can be recruited as a vascularized flap. If you irradiate this when the implant is still there, there will be some fibrosis. Other than that, if there is any trauma, then again there can be dystrophic calcification. Next, coming to the bone. So as you can see here, the bone gets compressed and thinned out at the place where the implant is, more pronounced right under the implant. Whereas in the lateral aspect, see, it is getting thickened out. This takes, in case of calvarial bone, around 2 to 3 months to come back to normal, and in long bone it takes approximately 2 months. Particularly while placing implant in infants less than 1 year old, we have to be careful because the calvarial bones can get inverted.